How much does psychotherapy cost?
There are several different fee structures for psychotherapy. A psychiatrist or a family doctor who's doing psychotherapy is covered by OHIP, so the patient doesn't have to pay anything, or they may pay a small charge on top of the OHIP coverage. The problem with that is because it's for free, there are sometimes really long wait lists, or many psychiatrists and family doctors don't even have a wait list anymore because they're just booked solid. A psychologist, we are not covered by OHIP, but many companies or universities will have some kind of private health coverage, and we can charge those companies if they have private insurance. If not, we are recommended currently to charge $220 per hour, and that hour is about 45 to 50 minutes of therapy, and the rest of the time is doing paperwork or administrative work. I try to stretch my therapy to an hour if I can do it. When I have so many clients in a day, sometimes it has to be, unfortunately, 45 to 50 minutes. Now, a lot of therapists or psychologists do have a sliding scale, which can be sometimes quite low for a few clients, to 70, 80, 90% of a normal cost. But the reality is that psychologists know that if a patient or a client needs a dentist, or if they need a chiropractor, a physiotherapist, an accountant, or a lawyer, they will find the money to do that. And so sometimes psychologists really don't want to give that sliding scale because they know that, let's say, psychotherapists who may have no training whatsoever, no degrees, no credentials, they're charging $150, $200, even more per hour. Life coaches who have absolutely no credentials or regulatory body or anything at all, they can be charging $500 to $1,000. So psychologists might be thinking, if we have this expertise, we have the credentials, why should we be the only ones who are giving a discounted rate? So I'm not going to begrudge anyone who has that perspective, and a lot of psychologists do recognize that, we do want to have a certain proportion of clients to whom we are going to give therapy for, at a reduced rate.